The word malnutrition is probably one most of us associate with the poorest countries, often afflicted by disaster. So it may come as a surprise that 1 person in 3 admitted to hospitals or care homes in this country is at risk. Nutricia is a medical nutrition specialist based in Wiltshire. Experts there are working with CCGs to develop a support service for all care settings. They say the collaboration could bring even greater benefits, as Piers Hopkirk reports.
As many as 3 million people in the UK are affected by malnutrition. Disease and disability puts many at risk. It's thought to cost around £13 billion a year in health and social care.
But the effective identification and treatment of malnutrition has the power to create vast savings for the NHS. And leading the way is Nutricia.
Nutricia is a leading specialised nutrition company.
Tackling malnutrition is really important because we can improve nutritional status, clinical outcomes and reduce healthcare use. It's important for the GP and the community particularly because improving nutrition support can not only improve quality of life for patients but also have an impact on the wider health economy, because managing malnutrition can reduce hospital admissions and readmissions, complications like pressure ulcers and infections.
And how can Nutricia help?
From training and education to our nurses supporting discharge from hospital and preventing readmissions, our delivery services to deliver products and pumps to patients. We also are a registered pharmacy.
Dr. James Kennedy is a GP. He knows only too well the budget pressures faced by clinical commissioning groups.
If we can tackle nutrition and malnutrition effectively, we will have much better quality of life for patients. We'll get much better outcomes with less input required to get those outcomes, and the improvement will be maintained for far longer.
Shailen Rao is an expert in medicines management. He says the argument for tackling malnutrition is a compelling one. Indeed, NICE has rated nutrition support in the top 3 guidelines for cost effectiveness.
On the face of it, the argument to find and treat people with malnutrition looks like an additional investment. But I think the reality is, as you get to understand it, that actually that return on investment can be delivered very quickly because malnutrition can be found fairly low cost and treated at fairly low cost in a short space of time.
For at-risk patients, Nutricia supplies evidence-based, high-quality oral nutritional supplements and enteral nutrition.
Good morning, Nutricia Homeward. Linda speaking. How can I help you?
Through its Homeward service, Nutricia delivers nutritional feeds, enteral feeding systems and nursing care directly to more than 23,000 patients. For Kathy and George Samios, the help and care they receive from Nutricia is vital. Their son Ethan has difficulty swallowing and has to be fed through a tube.
Our nurse from Nutricia was really sensitive, and she taught us what we needed to know without being patronising. She was available at the end of a phone when we needed her advice on things, when things didn't quite go to plan. Her calmness and her confidence sort of rubbed off on us, didn't it?
I've always found a real warmth and a real want and desire to actually get things done for you as quickly as possible.
It feels like the quality of care and concern that we get from Nutricia is on a level with the NHS. We don't feel there's any compromise there.
Nutricia, working in partnership with the NHS to deliver nutrition to those in need.